You want to hear some audiologists complain about the worst hearing aid features in the world for the next 30 minutes? You need to watch this episode. Hey guys, welcome back to the Dr. Cliff Show. I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And today we are going to be talking about the worst hearing aid features on the planet. But of course, I am joined once again by Dr. Rachael Cook and Dr. Kelsey Beck. Welcome back to the show.
Thank you.
All right, so we had to calm down before actually hitting the record button because we were kind of talking about the things that we hate most about hearing aids and the features that we just dislike. And, we figured we better hit the record button before we really get into it.
Yeah, can't be burning that high quality content before the episode even starts.
Exactly.
We do have that tendency, don't we?
We do. Yeah, we should really do like a pre-show. Like we should just hit record before we're ready to start recording.
Yeah.
And then that will just be the hilarious little shorts that we put out.
Agreed.
I was going to say lots of bloopers to come out of that one
Yes.
as well.
Yeah. So now we should preface this episode with the idea that we don't mean any ill will to any of the hearing aid manufacturers that are creating these features, any of the engineers that are responsible for their development. We've said a number of times that sometimes bad features or inconsequential features lead to better technological improvement down the road.
Yep.
Sometimes they're on their first version of said technology, and then it improves as time goes on, right?
Sure.
I mean, you're not at the type of Bluetooth connectivity that we have today if you didn't have the really horrible Bluetooth connectivity that was released in 2014. So kind of got to go through those steps. But here we are in 2024. There's still some technologies out there that I'm just like, how has this lasted beyond a decade?
Yeah.
Because it's completely pointless. And on the other hand, even if a feature works well for certain people, if it leads to a overall negative impact on the majority of people, you have to ask the question, is it actually a good feature?
Is it worth it? Yeah.
Or is it a horrible feature?
Yeah.
Right? And so just to kick it off, something when I was in grad school that we always talked about was this idea of frequency lowering, which is where a hearing aid would take some of the sounds in the higher frequency ranges that maybe someone couldn't hear because of cochlear dead regions or because their hearing loss is so severe out in the upper frequency ranges that you could take the hearing aid technology and either shift those frequencies down by transposing them down or by compressing them down. Either way, you're taking a high frequency sound and you're shifting it into a lower frequency region. So theoretically, someone could actually gain benefit from those high frequencies. Now, there's some research out there that would suggest that maybe this is beneficial for certain individuals with moderate to severe levels of hearing loss. Let me ask you guys this. Have you ever used a frequency lowering technique and had a perceived benefit from a patient?
Once.
One time, okay.
No.
No. I think I have had one, perhaps, anecdotal, like, I think this is maybe better.
Yeah, and that's kind of where my one is at. Is I was like, I think so, maybe.
And so the question is, from our perspective, like we like to measure and verify everything. So when you're doing real ear measurement and you can actually turn on the feature, turn off the feature of frequency lowering, and measure to see what kind of shifting you're getting in the frequency response on the real ear measurement screen. And sometimes I'm like, okay, there's a noticeable change in the output of the hearing aid, but oftentimes it's not like, oh, that solved the problem. That did what I wanted it to do.
And oftentimes I find perceptually, even when you do that verification and you can see that, you've been successful in shifting that frequency by whatever method that particular manufacturer uses, oftentimes I found that it just sounds odd to the patient.
Yeah.
Like, not necessarily better or worse, and they can tell you did something, but it just sounds weird because that's also not something that they ever remember hearing either. And so even with that report, I've had people go out and experience it, and then they come back and they're like, yeah, no, it still sounds really weird, and I don't want to get used to that one.
So when I was in school, I always thought of it like this. It's like, okay, wait, so you're taking these high frequencies, you're shifting them lower, and I'm like, does that make all women sound like dudes?
Yeah, if you've listened to it, there is kind of like a robotic, grovelly element that happens when you do shift those down.
And then here's my other thing. So when we think about the cochlea, our hearing organ, it's tonotopically organized. And so when you're actually taking frequencies that should be stimulating certain parts of the cochlea, which means that it's hitting certain parts of this tonotopic nerve that takes it up to the brain, if you're just shifting them into a different tonotopic region, aren't you just giving more of the sounds that you could already hear anyway?
Right.
Yeah, I think that's why it just sounds odd
Yeah.
to people, because it's not the way that the ear, the cochlea, the brain was really organized to receive that information. I think too that I have noticed in some fittings that I've looked at when others have come to like our clinic to have their hearing aids reprogrammed. I'll look like at the real ear that we get, and it's like, yeah, you met your prescription out to like 2,000 hertz, and then we've got all this frequency, transposition or compression or whatever, and we've turned frequency lowering on, and it's just like, you probably would have just done better had we just met your prescriptions in those high frequencies anyway, but you're not even anywhere in the neighborhood of meeting your prescription out there. So let's try that first. And oftentimes people are like, oh, like I can just hear and understand clearly now. So
I'm okay with the feature existing. I'm not okay with it auto defaulting on based on someone's prescription. I really don't appreciate that, because it really does change the sound processing that occurs in the hearing aid. And so I would love to, have it at my disposal if necessary. If there's kind of a we have a Hail Mary moment where it's like, all right, let's just try something out. But I don't want it to be on before I've even been involved in the process, because it can really manipulate how things get set up later.
And I would agree with you for 30% of hearing care professionals. Okay?
Yeah.
I wouldn't agree with that of having it available for the other 70%.
Yeah.
Because what I would imagine, because we know like the best practice data of, measuring and verifying and all of that, it's pretty low. 30% is even being very generous when it comes to that. But what I think is and Dr. Beck, you hit on it exactly, which is the idea that it can end up being a crutch for people, to where you're like, oh, let me just take this and shift it lower, when they would have been better just to attempt to do their best to hit the high frequency targets the best that they possibly could. And so what providers will end up doing, and I know this because I did it as a student, right, is like, oh, I don't need to go with a custom ear mold for this patient. I'm just going to turn on frequency lowering, and that's going to solve the problem. And Mr. Jones, don't worry, you get to use an open dome still for your extremely severe high frequency hearing loss.
Yeah, I feel like frequency lowering is, again, in that situation of, we've tried everything else. We have matched the prescription, we've matched our targets, we've done all of these changes and manipulations, and now, okay, we'll give this a go.
yeah, exactly. Well, and I feel like that there are other features that are like that as well. So like tinnitus maskers, for example. Like, again, I feel like a lot of, providers use it as okay, well, I can put this masker in, we're going to treat your tinnitus, fantastic, without doing all of these other pieces first, like meeting your real ear targets, making sure that you're actually meeting your prescription, right? If we did that first, you might not even be a person who needs to have a program that has a masker available to you. But we didn't do the first steps to then bring us to that next step.
I actually have patients who will come in and they will say, I've been doing my research and this is what I have found about tinnitus, and so I'm ready to get hearing aids, and they'll come in for their fitting and they're like, all right, and we're turning on tinnitus maskers today, right? And I'm like, oh, no, we aren't at all. There is an extremely strong chance that you don't need these. And tinnitus maskers in general, when we're using this type of a language, really is the idea that when you have tinnitus, and especially if you have tinnitus and a hearing loss, the idea is that tinnitus already comes from damage to the auditory system and not having enough input to the auditory system in the brain. And so it's basically your brain seeking out the input that it's missing and causing this ringing or buzzing phantom type of sound. When we are talking about tinnitus maskers, the idea is, okay, if we can return some of the missing sound to you, can we bring the perception of your tinnitus down. And so hearing aids, and I think pretty much every company has some form.
I can't think of one that doesn't.
I can't think of one that doesn't, exactly.
At least prescription hearing aids.
Yeah. And so what they'll do is they'll either be some version of like a steady white noise or a modulated sound like waves or something like that, that can run in the background of the hearing aids at a very low level, to try to take some of that tinnitus perception down. But for a large majority of individuals that have tinnitus, and especially those that have tinnitus with hearing loss, just being fit in well-programmed hearing aids that have appropriately been matched to your prescription is enough to do the trick. So jumping straight into, I will literally have patients come in and say, and we're turning that on today, right? And I'm like, no, we're turning that on if we get through this entire process and we still need a little bit more.
Well, the assumption for a lot of individuals with tinnitus is that having a hearing aid that is capable of treating tinnitus is the end-all be-all.
Right.
And really all hearing aids can do is one of two things, is replace missing sound due to your hearing loss, which for 60 to 70% of individuals will make their tinnitus go down.
Oh, yeah.
And then the idea of these tinnitus maskers, which is turning on this internally generated sound inside of the hearing aid, and you're basically replacing one for another, with this concept that you're going to use a masker to mask over the perception of the tinnitus.
And that's a big problem too. Even just the word masker, that's actually not the most effective way to treat and manage tinnitus, by just covering it up and hoping you don't hear your tinnitus anymore. Because
I know you don't like that sound, but how about this other sound?
How about
this
other sound?
Exactly.
And then guess what? As soon as you take your hearing aids off, what then?
You're still going to have sound.
Right, exactly. There's tinnitus management and tinnitus treatment is so comprehensive and holistic in general. So this idea of like, oh, you've got tinnitus, let me just click on, you could actually end up doing so much more damage and make it so much harder for someone to habituate to their own tinnitus by clicking on a sound that's not the right pitch, not the right volume, and then putting that in someone's ears all day, every day, all the time. Like,
And again, we all went to grad school, and tinnitus training, to be able to administer really good tinnitus therapies, that takes a lot of time even outside of school. I mean, we go over the basics in school, but I do not specialize in tinnitus. That is not my specialty, right? And for me to do that without, having that other kind of knowledge, that other type of education after grad school would honestly be a little bit on the unethical side, because I don't
think a little bit.
Yeah, I don't totally know what I would be doing. I know a lot because I work with you both, and you both are more experienced, and, particularly you, Dr. Cook, you really do specialize in tinnitus. And so I have you guys as resources, but anything that's beyond, that first couple of steps, I'm like, you know what, let me get you to my colleague who absolutely knows exactly what to do, exactly how to help you. This is right now outside of my specialty range, and that's what the ethical piece is to do. And I feel like a lot of people don't have, other colleagues as those resources, or just the knowledge to know that you don't have that, in your back pocket.
Yeah, or they just don't know any better.
Yeah.
Like you were talking about, we get some basic understanding of tinnitus in college and in our doctoral programs and everything, but it's not nearly as high level as it should be. So there are many providers out there that are trying to do the best thing for their patients. No hate, but I also think that it's definitely worthwhile to say, this is kind of outside of my comfort zone. I might not be the best provider for you in this moment. So it lets a lot of providers who aren't comfortable with tinnitus management say, I've got a solution maybe. We'll put this masker on. And I'm like, if you don't know what we're doing with the masker, I don't want you touching that thing.
Yeah, and I'm okay with, providers who aren't really into the whole tinnitus thing, and they're like, well, let me try this to see if it helps. The problem that I have with it is that now you start having audiology clinics popping up that include this hearing and tinnitus treatment in their name.
Yeah.
And really the only thing, in addition, that they're doing than just fitting you with hearing aids is that they're turning on a tinnitus masker. Because I see it all the time. People coming in, I went to this hearing and tinnitus place, and they come in because, they didn't really do anything. They they turned on this masking, sound. And if you listen to our podcast with Dr. Emily McMahon, she's like, tinnitus masking is not a treatment for tinnitus.
It's not. When we're talking about tinnitus management, we're talking diet and exercise, movement, sleep, stress, meditation and breath work, psychology. turning on a little bit of white noise in your hearing aids is not tinnitus management.
No, it really is.
It might be part of a tinnitus management strategy, but it is not the end all be all here.
Yeah, because really you're just trading one sound for another.
Correct.
Right? And it's not doing anything for the most part.
So I guess the moral of the story here is that if you have tinnitus and you've been told that like this is the tinnitus treatment for you, this masking, like you need to find someone else who knows more about tinnitus and treating tinnitus.
Absolutely.
Agreed.
Awesome. Okay, so that's 2 down. What is another feature that we're just like, what the heck were you guys thinking?
I personally believe that a lot of the fitness tracking, step tracking, physical activity tracking elements of hearing aids, I want to first start by saying that I appreciate trying to have hearing aids be a little bit more comprehensive of a health device. I don't think they're far off base, right? Like we have watches and phones, things that count our steps and our heart rate and all of these things. People want data about their own health insights. So I'm not mad at the idea. I'm mad at the execution thus far.
Yeah.
We've had a couple of hearing aid manufacturers now come out with even products that are branded to be these kind of health or fit type of devices, and then you wear them and it's so off. Like it's just, I mean, you've had experience with that. I know you had tried some out that you were like,
so
no
a
way.
little bit of a backstory, like I do a lot of, training and racing and all of that. And I would do tracking of heart rate data. I would track like everything, steps, all of that. And I have several different devices. In fact, we're both wearing Fitbits. You've got your Apple Watch over there. You can pretty much track anything that you want to on these that can be reasonably measured, right?
Right.
Heart rates, sleeping you can even measure with these. And you start to wear multiple devices. Like I'll wear this in my Garmin and go out for a run and come back from the run, and they'll be within 5% of each other from a distance and all of that. And then I go and I start wearing some of these hearing aids that are supposed to do the same thing, and they are 50% off.
50, yes.
It's insane how not on they are. And they end up not even tracking if you don't have your phone with you. So it's like, listen, if I wanted to take my phone with me on a run, I would have taken my freaking phone with me on a run. I don't want to have my phone so it can actually do the work of the hearing aid that's advertised as being this sensor tracker and all of that. And so I appreciate like the effort in moving forward, but I think that, people can buy a $400, device to wear on their wrist.
I mean, even less expensive
I was
than
going to
that.
say,
Or
you
less.
can go on Amazon and there are, non-branded ones that are $30 that'll hook up with your phone.
And they work very well.
And they work great.
Yeah, and so what? You're telling me that these like $6,000 hearing aids won't do as good as this $230, watch that I can buy on Amazon?
Yeah.
It's one of those pieces, it's a little bit like stay in your lane to some degree up until the point where it's actually going to be that functional. Because the other piece too is that if it's not going to work the way it's intended, right? And, we do treat a lot of older adults in our clinic, right? And they are wanting to use this for the health benefits. Like if their doctor is recommending that they start tracking their steps or like tracking their heart rate, things like that. And they believe that they can use this feature to do that when we know that it's really not that effective. That's another piece that kind of worries me, because if we're not giving you good data to utilize from that device, we need to not be using that device, especially if your intention is to use it for that purpose.
Yeah.
And I was told like 7 years ago, and I went to one of the manufacturers, and they're like, yeah, we're working on this. The ear is a place that is great for measurables, right? Like you can measure so much stuff from the ears, heart rate, respiratory rate. You can track like these impulses of your eyes shifting in different directions, like all of these things. But you're right, like they just haven't actually done that and done it to where it's stable. So it's really kind of discouraging, and it really just turns into kind of like this marketing ploy. But really what ends up happening is that people come in, they're like, great, I can ditch my Garmin and I can just use these hearing aids. And then what happens? They're like, yeah, these are not working the way that I was, like, why did they release these if they're not actually capable of giving me the data that I'm looking for?
I think that you bring up a really good point. A lot of times when new hearing aids and things are coming out, they do have to market these devices. And what do we hear in marketing all the time? Improved speech and background noise, improved sound quality, natural sound quality. Those get a little tired over time because every new launch is improved speech and background noise, So they come up with the other kind of flashier additions, features, elements, but they typically tend to not be nearly as robust as the actual, hearing performance of the device itself. So it ends up with people, it gets people in to say like, okay, I saw this and it seems really, really cool to me. And then I'm like, you don't want to burst your bubble here, but pop. It has not worked well, especially when we try them out, we use them, we wear them, we like put them to the test. And then we're like, yeah, I know you saw that really great advertisement for them and it was a great ad. It doesn't actually work that well in
Well, I have to ask, like, where are the focus groups that are happening with this? Like, who are they asking about this stuff?
And who tested it to say that it was functional enough to release it? That's really my bigger question. Is like, what was the research that they gathered on the functionality of the device? Because if we can wear them and test them, and we can assess that they don't really work, what are they doing in their testing processes?
Like, I'm an N of 1 in this, and I review pretty much every product that comes out on the market. And if I, as the N of 1, am like, this is massively wrong. Like, did I just get a bad device? Or was it, this is not ready for market?
Right.
Right? Because the chances of me getting the one, because all of them would be like, we got to make sure we get Dr. Cliff, like, the one that's working right.
Yeah.
If nothing else, get him the one that's working right, so he'll say nice things about it. But ultimately, some of these products that I've even reviewed, I won't even release the review on them, because even if I give a negative review, people think that I'm giving it like the stamp of approval for them to go out and buy. And I'm like, okay, I've learned from my mistakes in the past of really saying bad things about certain hearing aids because they were truly bad. And then I get, threats of litigation.
Yeah, so exactly.
Just stay
so you're like,
it's
what?
a balance.
You don't even get a review video, even though in the review video I would have said your product's awful, but we're not even going to go there.
Yeah.
So if you don't see a product review of a certain product on my channel, chances are it didn't deserve it.
It didn't make the cut.
Self-preservation is a great strategy.
Oh my gosh. So speaking of, different technologies that don't work, we really have to get into this idea of like different custom ear molds. And we could kind of group a couple different custom ear molds into one. I love custom ear molds. You guys love custom ear molds.
I do.
The purpose of a custom ear mold is to achieve a better level of amplification from a hearing aid, because you can trap more sound inside of the ears, prevent leakage of sound, so you actually get more benefit from your devices that you're using compared to like a rubber dome in several different cases of hearing loss. Not everyone, so some hearing losses you can treat with a dome, no problem. But I'm a huge fan of custom embedded receivers into the ear molds. And what it does is this makes sure that the tip of the receiver is deep into the ear as we want it, and we have a very consistent fit and consistent acoustics that we can build in to the actual ear mold itself with optimized venting and all of that. But there are a lot of ear molds out there that you just attach them to a stock receiver, put that in your ear, but that has some significant limitations, and the physical fit typically isn't quite as good.
Yeah, especially because you can't get that receiver as deeply into the ear canal with that kind of an ear mold. It's a little bit more superficial. You have to use a lot more gain often than you do with like an embedded receiver. I will say that they do have some benefit to it. So like, for example, if you're someone who keeps just breaking your ear mold, like just over and over again, that receiver wire just keeps breaking for whatever the reason is. The ability to switch them out on your own, the receivers, and just pop a new one in is really a great option. For someone who lives out of town, we do a lot of out of town, long distance care. For someone who lives out of town, having that as a replaceable part makes it a lot easier. You're not sending things in for as many repairs. But if it's really going to inhibit me from getting a really good fit of the hearing aid and have really good success while using the device, I really don't like it. And on top of that, the wires always stick out really far.
They do.
And so they make them very, very visible, and it's just not the look that most people are after.
Yeah, I would say that I have several patients that are in kind of the clip-on type of a mold, and more often than not, it's because from a acoustic standpoint and from an audiologic standpoint, I don't need to be trapping in that much sound necessarily, but perhaps they have kind of a difficult ear canal that domes just are not fitting into, right? Like most domes are a perfect circle. No person's ear canal I've ever worked with is a perfect circle. So if I have someone whose ear canals are really difficult, bendy, very like oval, long and tall, then perhaps that type of a style works well. But you have to have the right, audiometric profile, I would say, because if we're really looking to use a custom ear mold for amplification purposes and sound purposes, are you going to get that good of an experience with that? Perhaps or perhaps not.
Right. Oticon came out with a variotherm type of ear mold that at least allow you to push the receiver in to where the tip of the receiver was at the tip of the ear mold and not recessed into it by a few millimeters. So you would get a better fit with that, which was nice. But, oftentimes when you're using like a silicone attached ear mold onto the end of a receiver, they end up being really big, ugly. They stain, like they turn colors, and it's just like, man, that's gross. It's clean, but it's like, sorry, it's turned brown. It's not, the clear, opaque, clear color that it started off as.
Yeah.
And I mean, we get multiple complaints from people of that if you end up having to use an actual soft silicone ear mold that you're attaching onto the end of those. So I'm just not a huge fan. You end up looking at some of the Activent receiver as well. Now, Dr. Beck, so the concept.
I clearly have thoughts.
The concept of it. Good idea, bad idea?
I love the concept, particularly for someone who has normal low frequency hearing. So the idea of the Activent is that we still are able to fit you like we would with a dome, so have a very open fitting, allow a lot of good natural sound to come in, but then it has the receiver itself has this active vent where it will close the venting so that you can trap in more sound and kind of have this oscillating between having like a custom ear mold kind of style fit versus having like an open style fit. And particularly I see a lot of benefit when people have the, that normal low frequency hearing where we would want to have a more open fit. But then, for example, they do a lot of streaming from their devices. And so when you have that open fit, a lot of the bass from your music just leaks right out of that ear. And to be able to close that vent up, now you actually get kind of that effect like you would putting like AirPods in, where we can trap all that good bass in the ear and it sounds really good. However, I don't love it in practice, particularly if you work in like a busier clinic, because there are, a lot of steps to getting that programmed correctly. There are also a lot of, the receivers themselves, they don't last very long. They're rated to function for about 6 months. They only have a 6-month warranty. And so, you're replacing receivers relatively frequently. It can become very costly to replace those kinds of receivers, if they don't break down within that 6-month warranty window.
Right.
And then I also think too that at a certain point, for most people who want to utilize that, you probably could also just get away with the regular custom ear mold and be just fine as well. So I think that while it's great in theory, and I think that it could have a lot of great applications if it was, updated and kind of reinvented to some degree, I think that overall it's not the greatest feature to have available for people.
Yeah, I have some patients who they freaking love theirs. Like we've tried, either a dome fit on them to keep them more open. We've tried a seashell fit where we have a vent that's vented, but it stays the same vent size the entire time. It doesn't change, and so that can leak out some low frequency when you're streaming. You don't get as much benefit in background noise because some of that external noise is coming in through the vent or through the open dome. And so they love it to where they can either activate the vent themselves and shut it and close it, so they get more of the bass tones and block out some of that background noise. And then other times it works automatically when you go into certain situations or when you start streaming, you can actively close that vent. But you're right, 6-month warranty. I've had some patients who've been wearing them for a couple of years now without any issues, but we just had one this last week, which is why it's top of mind that receiver got some wax in it because there's an actual physical plunger inside of there
Yeah.
that has to be able to mechanically open and close. And because it's in your ear, there's wax that can work its way into these little pores that allow for the opening of the vent, right?
Those are very hard to clean.
And like
just
impossible.
on top of that.
I
Yeah.
mean, I don't know if
Very
I've
hard.
been successful at ever cleaning those.
Seriously.
And so you're looking at, $150 to $200, to get a new receiver every single time, and they're not following your hearing aid warranty. That would be a 3-year warranty, plus if you want a warranty extension, it's literally 6 months, and chances of having it malfunction within 6 months is very low. Chances of having it malfunction within 12 months, much
Very
higher.
high.
Yeah,
right?
exactly.
So, I, again, love the concept, and I remember talking about that. I'll take credit for it, I guess. But I remember talking about this idea of, it'd be really cool if, in times that you want to have venting, you have venting, and other times that you don't, something could shut and you actually do it. But, that might have been more of a precursor to having these solid-state silicone, speakers, like the MEMS speakers,
Right.
that can give you natural venting without losing the low frequencies.
Yeah,
Right?
I don't think that this idea is going to go away.
Right.
I think
No.
that definitely when we're talking about hearing aids and moving forward into the future, this idea of having different levels of venting in different environments and things, not only for streaming, but we've got a lot of individuals that wear open domes, and then they get into an ultra, background noise environment, and they say, I'm still not hearing as well as I'd like to in this background noise environment, and a lot of that is just simply from kind of that comb filter effect, where you've got some of the noise that's coming through the hearing aids itself, but some of that noise is just entering the ear canal naturally, and the sound that's entering the ear canal naturally, we can't process it. We're not actually doing anything to it.
Right.
So it's like, yes, it's a much more open and natural sound quality, especially when you have that good low pitch hearing. But what happens when we do get into these noisier environments? I don't think that this is going to go away. I do think that there's going to continue to be modification on it. I just think it's new, and with anything new, we're going to complain about it a little bit.
Well, and that's the thing too, though, is if you don't know what to fix if you don't have any negative feedback, right? And I think that this is a great concept, and like I said, I think it just needs to be reworked a little bit to make it more effective. But I think it's a great first stepping stone, and I'm glad that they did it, because it allowed us to, see what the benefits could potentially be if we really nailed the technology, right? And I think that's the part. It's now we know that it should work. We just need to nail it now.
Let's
So
dial it in.
venting and all of that obviously is a concept that's not going to go away. We're
Right.
going to build upon that. Another feature that is not going to go away is Bluetooth, all right? But a form of Bluetooth that needs to die a fast and painful death. It's
a little bit of an oxymoron, but we'll go with it, it's fine.
It's like slow and miserable, or fast and painless,
whatever.
right? No, it needs to be fast and painless if you ask me, or fast and painful if you ask me, is the Asha Bluetooth protocol.
Yeah.
I understand the concept. So for anyone who doesn't know what the Asha Bluetooth protocol is, it's what allowed made for iPhone hearing aids to be able to communicate with Android devices. And concept is great. It's perfect. Now we don't have to select a certain type of hearing aid for you if you have an Android phone, or you don't have to go out and get an iPhone that nobody wants anyway for a, I thought you guys might like that.
We're ignoring that. It's fine.
To be able to do Bluetooth streaming. So now you can have your made for iPhone hearing aids. If you want an Android phone, you can still do the streaming. The problem is that it's horrible.
Yeah.
Hardly ever works, and the quality of it's poor. And it's just one of those features where you're like, listen, appreciate the effort. Can we stop doing this now?
Yeah.
Yeah, again, it's one of those things that needs to be reworked, right? We need the made for iPhone hearing aids to connect with non-iPhone phones. We do. I mean, it honestly should be a standard at this point, because not every single person, and particularly around the world. I mean, I know that in the United States, we're pretty much, inundated with the use of Apple and iPhones.
Right.
But actually around the world, that's not the
not true,
case,
yeah.
right? And so really in other countries, you're really limiting other people's benefit, because we don't have this worked out. You have made for iPhone hearing aids that are great, especially if you're looking, you're doing your due diligence of picking the right hearing aid audiometrically for somebody. But then you get pigeonholed because, that Bluetooth is going to be a little bit spotty for you, right? And so again, really great concept, needs to be reworked.
To be fair,
No.
I'm actually adding to the hate here. I'm not actually saying that Ash is good.
To be fair, it's worse than what you guys are talking about.
To be fair, the made for iPhone Bluetooth connections aren't that strong either. So I'm a hater of most Bluetooth connections at present.
Fair.
There's, using the Bluetooth Classic typically tends to work pretty well, but there's only 2 companies that do that. So anyway, we will be seeing major improvements in the Bluetooth space here shortly,
Totally.
so I am not concerned about it, but I'm just a hater of both made for iPhone and Asha streaming
just hate
protocols.
everything.
I just hate it all.
If it doesn't work, I don't want it.
That's if it's not robust, I'm not in.
Well, the funny thing is that when you look at, so I agree with you, from a streaming perspective, Bluetooth Classic's going to give you the best stability, the best clarity on the stream compared to the made for iPhone Bluetooth Low Energy and the Asha Bluetooth protocol. But from a app perspective, I find that there to be a lot of glitches from the Bluetooth Classic connection devices, because they are also using an LE or a low energy form of Bluetooth, and that's super spotty, and you make some changes, they don't stay, and it's like, what are we doing here?
It's a mess.
Yeah, and I think that one of the number one complaints that I get about any hearing aid fitting across the board, doesn't matter what the manufacturer is that there are Bluetooth issues.
Yep.
Which, to be fair, a hearing aid is not like you're supposed to be able to hear, right? But now, because again we have such an integrated world, we do so much by Bluetooth. We have tiny devices, earbuds that have great and robust Bluetooth. Why is the hearing aid space struggling?
Yeah.
Why is this something that we cannot figure out?
Yeah.
I refuse to believe that there isn't an engineer in any of these places who are like, you know what, maybe we should just make our Bluetooth work.
Yeah.
Like, this person needs a raise.
Can't we just steal the technology that Apple is using with their AirPods, where I can walk like 100 yards away from my phone and it still works?
Especially because it's one of the biggest complaints that hearing aid users have. Listen to your users.
I will say, LE audio, Bluetooth, range and stability and all of that, sound quality is substantially better than
So much
all
better.
of the other 3 forms of Bluetooth that
Then
we
let
currently
us
have in
roll
hearing
it
aids,
out.
right?
Well,
and it is
by
here
2027,
to-
90% of smartphones will have LE audio
There we
capabilities.
go. I feel like
So,
that's way too long in the future.
way too long.
What
I
the
know.
heck,
I
people?
know.
Yeah, why are we, again.
Yeah.
But again, here's the thing. Like I said, if it's not robust yet, I don't really want it. If it's going to take 2027, but we get it done the right way the first couple times, I might be okay with that. I might be good.
Okay, Dr. Beck, what is another feature that maybe is amazing but isn't quite robust enough for your to your preferences here?
And I will preface this by saying I utilize this feature all of the time. I love the feature when it works, 100%. Roger receivers. Oh my goodness. So for those of you who don't know, a Roger device is one that is an FM system that will connect to your hearing aid. They are made by the company Phonak, and so they pair really well with Phonak hearing aids. You have to have some other steps to get it to connect with, other manufacturers, but all of that is possible. And the way that they do this is by having this software essentially called a receiver. And now they have everything now integrated, which is great. So you purchase this Roger microphone device, right? And inside the device, it has 2 Roger receivers that you have to upload into the hearing aid. Now, when you have this upload process to do, any number of things can go wrong. I have receivers that disappear into thin air, that end up in hearing aids that aren't even turned on, and we've got a ton of hearing aids in our office, and they honestly can go, these receivers just disappear. But what they do for like our loaner devices of like the Phonak hearing aids is that they are just already have them integrated into the hearing aid themselves, and you don't have to even bother with this uploading process. My question is this: why can't there be some sort of button I click, code that I enter, when someone does purchase this device, to let them know that we just have to activate this within the hearing aid already, instead of dealing with this, jumping receiver, trying to upload it ending up in Timbuktu? Like, why is this so complicated? It doesn't need to be. It literally doesn't need to be.
Well, literally, people hearing care professionals and consumers are just confused by the whole concept. So, when they purchase a Phonak hearing aid, pretty much any Phonak hearing aid right now, if it's wireless capable at all, has an embedded Roger receiver. So when they purchase it, they're like, great, I have the Roger receivers. Well, nah, you have a Roger receiver, but it's not active yet. You need to upload the software into it to make it active. And it's like, wait, what? You have to do what? And then on some individuals, when you're purchasing the IN version of these Roger devices, that will have the 2 receivers inside of it that you can then upload directly from that unit, like the Roger on IN, directly into your Phonak hearing aids and have everything active and it's ready to go. Okay. Other individuals, let's say that they already have a Roger device, but they just bought these new amazing Phonak hearing aids that have the embedded receivers. Well, this old Roger device doesn't have the receiver software in it to upload into the embedded receiver hardware that's inside of the devices. So what do you have to do? You have to purchase an extra piece of hardware called the Roger X receiver, and you have to buy 2 of them that you then have to go in and wirelessly upload, and then you're doing it through this little hockey puck transfer thing, and then, like you said, it's like, okay, well, I had 2 to start, only 1 uploaded, where the hell is the other one?
Yep.
And then you're like, okay, I guess I gotta use a demo one that we have in the back. We have to take the receiver software off of that one, because once you use it once, it's gone. It's not on the hardware anymore. You might as well just throw the hardware away. But then you start using that, and then you have to call your rep and be like, listen, I followed the upload process, and it still didn't upload into the hearing aid, and now it has vanished into the ether. We don't know where it's at right now, right? And maybe someone walking outside with a Phonak hearing aid now has a Roger receiver.
Which is entirely possible. Like, why have we created this to be a possibility?
I know.
And again, who was testing it? Because if you had more than 1 hearing aid in that room while you were trying to test this process, I guarantee you lost at least one of them.
Yep.
Well, every time, so we're big into policies and procedures and building agreements inside the clinic. So I was working with Bree when she was at the clinic, and we're like, we took these receivers, and we ended up going and establishing the process, and everything worked perfectly. It always works perfectly when you're not trying to do it for a patient.
Correct.
And you're trying to get it done within their appointment time. It always just vanishes. And then, if you're like, well, shoot, we don't even have any loaner devices here. And then what happens again is that you take these hearing aids, they're like, they need to go in for repair at the manufacturer. They have receivers on them. You send them to the manufacturer.
With big bold letters that say it has receivers in them.
Do not send back without the receivers.
And what do you think they do?
Send them back without the receivers.
It drives me freaking crazy. And then it's like, well, then what are we supposed to do? Hey, we need you to send us extra receivers instead of your idea, which is, can I just go into the software and click upload a receiver into this device while I'm connected to the software? If you want to bill me, the clinic, bill me.
Yep, we
right?
have account management systems for other types of products like Lyric, right? Alps that manages these subscriptions and things. Why can I not go into the software and say, purchase receiver, it will be entered into that person's own device, and then that's it. There's no concern from that point forward.
Exactly. Or like when you get the box with like the device in it and it has a code that's specific to the device you just purchased, so that it's maybe not an additional cost on top. Like, why?
Right.
The 3 of us, have clearly in the last 3 minutes come up with some really good options for how to do that.
Now, don't ask me to code that into the software.
Well,
I don't know how to do it.
We also have not brought up the fact that you use the word receiver. Where else do we use the word receiver all day, every day, all the time? A physical object, a speaker unit. When I was working at the VA, this idea and concept of Roger receiver technology nearly had me calling it quits on audiology. Because I'm talking on the phone with someone and they're like, no, you need a Roger receiver. And I'm like, well, what's a Roger receiver? And they're trying to explain it to me and they can't explain it. And I eventually, after calls and messing this up and can't pair, I eventually realized, oh, we're talking about an invisible element here.
Yes.
This is not a real, they're like, oh, you don't have the Roger receiver, you didn't install it or whatever. Install what? What am I installing? And they're like, oh, well, it's actually just this invisible software transfer, la la la. I'm like, oh, that's why I'm losing my mind? Because you keep saying that I need to install this receiver that doesn't it's not a physical object. It's a virtual receiver, but we talk about receivers all day long with actual speaker units. Anyway, it was just, I'm like, okay, we need to change the naming of this. We need to change how you educate providers about these systems.
And maybe make a really good cheat sheet
Yes.
for all of it, like the nomenclature, because like, again, you know, we go over Roger devices and FM systems and all that in school, and then once you get out into the real world, once they kick you to the curb, and you're now trying to, again, learn how to do this all in practice, I mean, it is mind-boggling, the things that, like, you need more education on, and you need the time to do it. But like, if we're naming things the exact same word, it just doesn't make any sense. Doesn't make any sense.
To this day, the most difficult video I have ever scripted and filmed was explaining how this Roger receiver technology works.
Because it's like, it's explaining like the cloud to people who don't understand technology, right? Like, it's this mystical thing where all of your data lives in this cloud. Well, how do I get it down from the cloud? Honestly, like, it's just, you just click it, and they're like, well, what do you mean? I mean, it's a whole thing.
It has to rain before you can get it down.
It reminds me of Matthew McConaughey in Wolf of Wall Street, where he's like, it's fairy dust. It's fairy dust. It's nothing. Like, that's exactly how I feel, where I'm
hilarious.
like, it's nothing.
All right, so I think, can you check your heart rate? Because I feel like you're just, like,
Fired
on
up.
fire.
You don't even want to know what it is right now.
Okay, all right.
So you don't want to know mine either.
For sure.
Yeah, we
But
both.
this has been a very interesting discussion. I am interested to know if you guys have certain hearing aid features that you think are completely ridiculous and a waste of time. If you have those, please leave them down in the comment section. If you guys enjoyed today's episode, please hit the like button. And if you are not subscribed to the channel, go ahead and do that as well. And we'll see you next time.